Okay, picture this. A tiny microscopic egg. You don't even know it's there. It gets ingested, maybe by you, maybe by your pet, and then it starts this really complex, sometimes pretty dangerous journey inside the body. That's kind of the hidden world of the roundworm. And honestly, it's way more common and powerful than most of us probably think. We get a lot of questions, about roundworms and pets. It's totally natural if you share your home with a dog or cat, right? You worry about these things. And that curiosity is exactly what got us started on this deep dive today. But here's where it gets interesting. While you might be thinking, okay, let's talk about Fido's worms, the actual research we dug into for this, it mostly focuses on human roundworm infections, specifically this one called Ascarius lumbricoides, but hang on, don't worry, we're definitely not ignoring your pets here. The whole point of this dive is to sort of extract the big picture, the universal rules about how roundworms work, how they infect, that apply pretty much across the board to vertebrates. That includes our pets, of course. So think of this as like a shortcut to getting really informed. We're looking at the fundamentals, the mechanics, the risks, the prevention that work, whether the host is human or, a hamster. It's about the core biology.
Exactly. And that's what's so useful here. Because even though the specific species of roundworm might differ a bit between, say, a dog and a person, or the exact medication might vary, the fundamental biology, how these things operate in a vertebrate host, is remarkably similar. There's just so much overlap. So by looking at the human side, where there's just a ton of research because it's such a big global health issue, we get this really solid framework. It gives us great insights into how infections happen in general, what the potential dangers are, and the best ways to stop them, which are, highly relevant for pretty much all vertebrates. It's an efficient way to use what we already know.
Yeah, it really is a smart way to leverage all that data. It makes you kind of reconsider maybe looking at the human angle first is the best way to understand the pet situation too. Okay, so when we talk about roundworms, it's not just like one or two types we're dealing with. What really jumped out at me from the sources, what the sheer scale of this family. They're in this group called the phylum Nematoda, and it's massive. We're talking over 80,000 known species. Just let that sink in. 80,000. And they are incredibly diverse. You find them basically everywhere. Some just live freely, doing their own thing in fresh water or soil, even inside plants. But a huge number of them, and this is key for us today, are parasitic. They live inside other organisms, especially vertebrate animals. So yeah, if your pet is a vertebrate, and let's face it, most pets are, right? Dogs, cats, birds, reptiles, they are definitely on the potential host list for some kind of roundworm. It's just a massive part of the ecosystem.
80,000 species, yeah, it's staggering. Really speaks to how successful they are, evolutionarily speaking. And even with all that diversity, there are these common ways they operate, especially how they affect their hosts. And if we connect this to the bigger picture, it really highlights not just how common they are, but also the potential danger. I mean, a lot of roundworm infections might be mild. Maybe you don't even notice symptoms for a while. But the sources bring up one example that's frankly quite chilling. It really puts the potential harm into perspective. The raccoon roundworm. Now, this isn't just about a bit of an upset stomach. In rare cases, yes, but severe ones, this particular roundworm can cause really devastating outcomes. We're talking things like blindness, coma, even severe neurological damage in the animals it infects. And the scary part is it can do the same to humans if they accidentally ingest the eggs. So that specific example just hammers home the point that even though we're dealing with microscopic eggs and tiny worms, the results can be incredibly serious. It's not all the same, of course, but it shows some types are genuinely dangerous.
That is definitely a sobering thought, a powerful reminder, really, not to just brush these things off. Okay, so that's the big picture, the scale. But how do these things actually get inside our pets or us? The sources seem pretty clear on this. The main infection route, the universal one, it's pretty straightforward, though maybe a little unsettling. It's usually by ingesting contaminated soil or food or water that has the roundworm eggs in it. Just think about it from your pet's view, right? A dog sniffing around the park, maybe digging a bit. A cat exploring a patch of dirt where maybe another infected animal went to the bathroom earlier. Or even just lapping up water from a puddle sometimes. If those spots have the eggs, well, it's incredibly easy for them to get swallowed. It certainly makes you think twice about letting your dog thoroughly investigate every interesting patch of ground, doesn't it? It's just a very clear picture of how easily this stuff spreads. Makes environmental hygiene really, really critical.
Exactly. And building on that, how they get in, that naturally leads to the next question. What does it look like when they are in? What signs, what symptoms should you be aware of? And like we said, our main sources detail human symptoms, but honestly, they serve as really strong reference points for what severe infections could look like in animals too. They're a good general guide for the potential impact. Let's maybe break down some of the key symptoms. They often kind of follow a pattern as the worms develop. First off, you might see respiratory symptoms. This is a really key phase because when the tiny larvae hatch from the eggs in the gut, they don't just stay there. They actually migrate. They often travel through the bloodstream, end up in the lungs, then they get coughed up, swallowed again, and then they mature back in the intestines. It's quite a journey.
Wow, okay. So the lung part causes problems.
Yes, precisely. That trip through the lungs is what can cause issues like a nagging, dry cough, maybe some wheezing, shortness of breath. And in really bad cases, you might even see someone coughing up blood. Then, okay, once the adult worms are settled in the gut, that's when you start seeing the gastrointestinal symptoms. And these can be pretty nasty. Things like intense abdominal pain, vomiting that just won't stop, diarrhea, which can sometimes be bloody, or even the opposite, like really bad constipation. And in really extreme situations, if there's a huge number of worms, they can actually ball up and physically block the intestine. That's an intestinal obstruction. And it's a serious medical emergency. Needs immediate help.
Okay, so gut problems make sense. What else?
Well, beyond the immediate pain and discomfort, there's the nutritional impact. You have to remember, these parasites are essentially stealing nutrients from the host. So if you have a lot of worms, they're competing for food. This can lead straight to weight loss, maybe failing to grow properly in young animals or children, and general malnutrition, even if the host seems to be eating okay. It's like a slow drain.
That's insidious.
It is. And it doesn't necessarily stop there. As those larvae are migrating through different body tissues, or just as the body reacts to the infection overall, you can get broader systemic symptoms. These can look like other illnesses, things like a high fever, chills, aches and pains in the muscles or joints, feeling really weak, just exhausted all the time. It can really make the host feel sick all over.
Right, so it could be mistaken for the flu or something else entirely.
Exactly. Diagnosis can sometimes be tricky if it's just based on these vague systemic feelings. It can be a bit of a detective story, like you mentioned. And then perhaps the most, shall we say, striking detail, the one that makes it very real, is that in severe cases with a really heavy load of adult worms, the worms themselves might actually become visible. You might unfortunately see them in vomit or in the feces.
Oh, wow. Okay. That's certainly undeniable evidence, isn't it?
It is. It's a very clear sign of a heavy parasitic burden.
That whole list is, well, it's pretty intense. It really paints a picture of how damaging these things can be. Definitely not something minor. So given how common this is and how serious it can be, how do doctors or vets actually figure out for sure that it is roundworms causing the trouble? How's the diagnosis done? The sources point to a couple of main ways. The standard approach, the most common one, and it's pretty much the same for humans and animals, is a fecal examination. Basically, taking a poop sample, putting it under a microscope, and looking for those characteristic roundworm eggs. Sometimes you might even see larvae. It's the go-to method. The vets do this all the time for pets. It's that consistency, again, that fundamental approach across different species.
Right. That's the baseline. But what about trickier situations? Maybe the infection is really heavy, or it's causing complications like those blockages we talked about. In those more advanced cases, imaging techniques become really important. Things like X-rays, ultrasounds, sometimes CT scans or MRIs. These tools let doctors or vets actually see inside the body. They can spot large clumps of worms or figure out exactly where an obstruction is happening or see other damage the worms might be causing internally.
Okay, so microscopy for the basics, imaging for the more serious stuff. Makes sense.
And then moving on from figuring it out to doing something about it. The good news is we do have effective ways to treat these infections. There are anti-parasitic medications. The sources mention common ones like albendazole and mebendazole. These generally work by messing with the worm's ability to absorb nutrients or use energy. Basically, they starve them out. Another one sometimes used is ivermectin, depending on the specific type of roundworm.
And these work for pets too.
Yes, largely. The same classes of drugs or very similar ones are used in veterinary medicine. Vets will choose the right one based on the animal, the specific worm, the situation. But again, the basic pharmacology often crosses species lines, which is helpful. But, and this is really crucial, treatment isn't the end of the story. Prevention is absolutely key, because if you treat an infection but don't change the conditions that led to it, reinfection is really likely. The cycle just starts over.
Right. So how do you prevent it?
Well, for humans, especially in places where these infections are common, it's a lot about improving sanitation, clean water, proper waste disposal, and personal hygiene, like hand washing. For pets, this translates very directly to their environment. It means keeping their living spaces clean. So picking up dog poop from the yard promptly, cleaning litter boxes regularly, and trying to prevent them from eating or drinking from potentially contaminated sources, keeping an eye on what they're getting into when they're outside. That diligence really matters.
Makes sense. Constant vigilance.
Pretty much. And tying it all together, especially for pet owners, is regular visits to the vet, getting those routine checkups, fecal exams, and following their recommended deworming schedule. That proactive approach is fundamental. It helps catch things early and keeps breaking that cycle of infection to keep our pets healthy.
That's really practical, excellent advice. So, okay, let's recap a bit. We've seen roundworms are super widespread, part of this huge family, affecting lots of animals, including our pets. And they can cause a whole range of problems, some mild, some really quite serious. But understanding these kind of universal principles, even if we started by looking at human research, gives us a really strong foundation. It helps us recognize the threat, know what symptoms to maybe look out for, and understand the basics of diagnosis, treatment, and especially that crucial prevention piece.
Exactly. And, this raises maybe a final broader thought to consider. While we naturally focus on the immediate problem, the infection, the symptoms, getting rid of the worms, it's worth thinking about the deeper long-term relationship here. This constant evolutionary dance between hosts like us and our pets and parasites like roundworms. How have these tiny organisms, often completely invisible to us, actually shaped the health, the immune systems, maybe even the survival strategies of countless species over millions of years, including our own? It's just a fascinating glimpse into the hidden but incredibly powerful impact of the microscopic world on life as we know it. It's always influencing our biology in ways we're still figuring out.
That's definitely something to mull over as you go about your day, a much bigger perspective. And of course, remember, if you have any specific worries about your own pets, the best thing to do is always talk to your veterinarian. They're the real experts for your specific situation. Thanks for diving deep with us today.